Hi, I'm Toya Brasky from Galveston, Texas. My Facebook and X account is Galveston Psychic Paranormal Researcher. I'm also under Toya Brasky on Facebook. Today is March the 31st, and I wanted to share with you my story about going for a breast biopsy today, March the 31st, 2025, and what brought me here to this appointment. So previous to this breast biopsy, I had in my 20s had 2 lumpectomies for breast lumps. At that time, they removed the lumps and they also took out tissue from my breast. So when they took out the tissue from my breast, specifically my right breast, it left my breast uneven. So at that time in my 20s, they put in mastectomy implants, which were called the meme or the replicon. Now those implants were silicone and they had a polyurethane coating. So shortly after I had my surgery, the surgery was wonderful. My surgeon was the best of the best. In fact, during that surgery, I probably had no bruising whatsoever, and my scar was so razor thin that you could probably never even see it unless you got really close to me and examined me. That's how well of a surgeon I had. But about a year after I had the implants put in, they were recalled for defectiveness. So I was offered a settlement to have them removed, but at that time I decided that I did not want that. Breast surgery itself and having your muscles cut to put in implants is very painful. I did not want to go through that again. I did not want to have another surgery, so I opted out of the lawsuit and decided to keep the implants in my body. So, years passed. I am 61 now. So for a good 40 years, I really didn't feel like I had any issues with the implants. If I did, I didn't notice any symptoms of it. But when I turned 60, somewhere between 60 and 61 over 2024, I began to have a leakage in the center of my chest. It was not out of my breast. It was out of the center of my sternum. And this leakage, at first I thought it was just sweat. And I was thinking, well, I've gained 50 pounds. I'm just old and fat now, so it's probably just sweat. So I started putting deodorant between my breasts, and that worked for about maybe 3 months. And then the deodorant stopped working. I kept having leakage from my chest. At this point, I was putting paper towels in my bra. And I thought, this is very unusual because I'm not a person who sweats. So I didn't have insurance through my employer, so I did not go to the doctor. And then it became worse. The substance that seemed like a sweat began to have a foul odor, a really foul odor, where I was going to the bathroom at least 4 times a day during my work shift, washing the center of my breast to try to get rid of the odor that was between my breast. Even with deodorant, it was coming through. And then it began to turn into like a sticky, oily, like odorous leakage that was coming out of my breast. So because my employer did not offer health insurance or benefits or sick time off, anything like that, I went ahead and I applied for healthcare.gov. And the reason that I did that was because I didn't have any other options that I could afford for insurance. And I knew that I had a problem. Now, I joked about it and I said it's probably just because I'm fat, and it's going to turn out to be absolutely nothing. And I'm going to get the report back and it's going to say no results found. You're just fat and you're old now. But that wasn't the case. So I did suspect that if it had to be anything, it would have to be that the implants have ruptured, and that's probably what the leakage is. So I was a EKG technician and a cardiac telemetry monitor at University of Texas Medical Branch for several years. And so I got to know several surgeons. I just happened to meet the chief fellow of plastic surgery, a wonderful woman, while I was there. And so the first person that I wanted to ask advice from was her. So I emailed her and I told her, I said, look, breast cancer runs in my family, so does fibrocystic disease. I had implants put in 40 years ago. I really feel like this is not cancer. It is probably just the implants have probably finally ruptured. So immediately she emailed me back and she said, I'm really concerned about you. I want you to come in. So immediately she did order tests for me. She ordered a breast MRI. She ordered a mammogram. And unfortunately, because of my work schedule, I missed the mammogram. But I did go for the breast MRI. Now, during the breast MRI, it found multiple masses bilaterally on both sides of my breast. So I was in the MRI for about an hour and 15 minutes because during that test you have to lay face down with your boobies hanging in a basket, and you can't move. You have to be very still. But I had COVID in 2022 and I have to breathe very deeply. So I kept taking deep breaths because I was laying on my stomach, and it was very uncomfortable because when you're laying there, there's also like a metal bar that's between your breasts, kind of pressing on your sternum. And so it was very uncomfortable. Plus your arms are falling asleep because your arms are up like this. So I kept moving a lot in that test, and so they could see the breast lumps or breast masses, but some of that was unclear. So then, because they found so many masses in my breast on both sides, then they wanted me to come back for a diagnostic 3D mammogram, which is called tomosynthesis or 3D mammogram, and also for breast ultrasound. So on both of the latter tests, the 3D mammogram, which is different than a regular mammogram, a 3D mammogram takes several slide pictures of your breast, and it is also a diagnostic mammogram for people who have been found to have issues or concerns with their breast. I also had a breast ultrasound. On both of those tests, it revealed that I also had multiple masses in both breasts. Now, the concern was that although I do have fibrocystic disease in my family, actually my sisters and even my brother have had breast lumps, but my mother is a breast cancer survivor. Now, most of the scattered masses in my breast are oval, meaning they're probably benign. Some of them definitely look like cysts, solid black in the sonogram. And then some in my right breast were irregular in shape, which gave the radiologist concerns. So today I will be having what's called a core needle biopsy on my breast and also a cyst aspiration. So the good news is about 80% of all of the breast biopsies are benign findings. Only about 20% of those end up being cancer. So I have some hope that this will turn out to be nothing more than cysts and fibroids, and that I'm going to be absolutely okay. But then there's the terror that my mother was a breast cancer survivor, and I really hope that I am not a recipient of her cancer gene. So I don't know how this test will turn out, but I did do some research, and at first I was terrified because I looked at YouTube videos of the core biopsy, which they use a really large, maybe 14 gauge needle. And then I heard that they have to kind of stab the mass about 5 times to get tissue for the biopsy. And so they kind of poke you with this needle into each of the masses, and then they kind of pinch out tissue, and then they put it on a slide. And I have several masses in my breast, so that's going to be poking me quite a lot. But I also found out that before they do that they put topical lidocaine on each breast. And then after they put the topical lidocaine, they give you injections in the breast of lidocaine to numb the inside of your breast. And they said that you will feel that. You'll feel the slight sting of the injections of the lidocaine that is put in the breast. But after that, your breast will go numb, so that when they are doing the biopsies, that you won't feel a lot from the procedure. Now, I've heard that it can take a couple of days, 2 to 7 days to get your results back, so I won't know anything right away. I do have an appointment with the surgeon the very next day, on Tuesday, and I'm glad that I can talk with her because I have so many worries and concerns about what is going to happen. Regardless of whether the masses are benign or cancerous, I will still have to have surgery because both implants have completely ruptured in my chest. I'm going to have to take those out. They are underneath the muscle. So they're going to have to recut my muscle, take those out. And what I would like to happen is, my breasts are very important to me, and aesthetically I would still like them to look attractive. So I am considering putting in another breast implant, but this time probably I want to ask, instead of putting it under the muscle, can they put it inside the breast? Now, right now, my breast size is about a D cup, and that is with the ruptured implant. So I don't want massively huge breast. I want to be careful not to go too big with the implant, but if they have to take out tissue, I just want them to fill the breast back up to maintain the shape that they are now. I'm lucky in one way that I have very dense, thick breast. So I've always liked my breast. I've always thought, you know what, I have attractive breasts. I love my breast. But on the downside, dense breasts are more susceptible to cancer. It also makes any type of screening, like ultrasound, mammogram or MRI more difficult to see breast masses. Because of the density, it's very hard to see them. So it's kind of like a catch-22. Now, they showed me many options for breast reconstruction if I have cancer. But I'm probably the most unconventional patient, because at no time do I feel like I will ever accept a mastectomy. My mother did not cut off her breast. She had radiation. Now, I'm such a holistic person that I will have difficulty even with radiation or chemotherapy. I do not want to have a mastectomy. My expectations are that they can take out whatever tissue they want to take out, but I still want the skin of my regular breast and nipple to remain the same. I only want a scar underneath the breast. I did not like the patch quilt look of the reconstructed breast where they had a scar going up to the nipple, or they cut out the nipple and moved the nipple. And there was really another surgery that was just terrifying, where they had an option to take out a flap of the stomach, which everybody would like a tummy tuck. But they actually cut out your lower abdomen, use the muscle in the skin, cut off your breast, put that skin from your abdomen on your breast, and then sew it around. I hated that. I just hated it. The scar was so bizarre, to have a round circle around your breast, to sew on skin that is not actually your breast. And I hated the option of completely cutting off the breast. I would never do that, even if my life was in danger. So, I can already feel that if it turns out to be cancer, that my doctors are probably going to be a little bit upset with my decisions. Now, I always like to talk about something funny. So, I told you that I'm a very holistic person, and I greatly believe in ivermectin and fenbendazole for treating cancer. And even if I had to go across state lines or order it online, I would probably take that route over chemotherapy or radiation or a mastectomy. I just feel like that is my choice, if that is what I want to do. Also, I am not a cannabis user. I can't stand to smoke. I don't like the smell of it. But I love the healing stories of using cannabis oil. So if I had the money, I would move to another state where cannabis is legal. I would probably take cannabis oil, cannabis, by mouth some way. I would probably take fenbendazole and ivermectin and just live my life, and whatever happens, happens. Now, I'm not concerned at all about death. Even if I died from cancer, as a psychic who knows that they know that there is an afterlife, I have talked to so many spirits, and when you do that, you know that there's an afterlife. So for me, death is not final at all. Death is just shedding this avatar and really graduating to eternal life. And I've talked to so many spirits on EVP that I'm absolutely 100% convinced. I know that there's an afterlife. So we don't die. I'm not afraid of dying of cancer. I'm afraid of living with cancer and the expense of it, or the burden of having to be sick for a long time, of not being able to work to take care of myself. And also because we have such a just delusional system, healthcare system. I don't know if I refused to take chemotherapy or radiation or a mastectomy and I decided to treat myself, I don't know if I would be denied any type of disability benefits or something to help me live my life, because our system is made up to kind of control you. So that's a concern for me. That's a concern that the minute that I say that I don't want to go the conventional way of being treated, if I have cancer, I may run into roadblocks. Now, this may not be cancer at all. I may turn out really, really lucky, come out of there, and in a couple of days hear that it was nothing more than cyst, nothing more than benign findings. I may get even better looking breasts when they exchange the implants, when they take out the ruptured ones and put in new ones. And that will make me very happy. I hope that that's the way that it turns out. I really do. So today, think about me. I will be in the breast biopsy between 12:30 and about 3 o'clock today. And of course, I won't have my results for several days. But it is something that as a woman, it's very hard to go through, because I am a very feminine woman. I've always loved being feminine. I like having a very shapely body. I like having curves in my body. I love having long hair. So that is part of the reason that I don't want to have chemotherapy, because I don't want to lose my hair. And to some of y'all, that may seem like it's superficial, but really there's nothing wrong with wanting to still be yourself in every way. And I hope that everything comes out just absolutely normal, that I'm like the 80% of the women that go in that are afraid and scared for the day. And after my results come back, I get good news. So wish me well. Bye.